Hello, this is Dr. Vikas from India. So today, my patient is a 10-year-old girl who came to me with excruciating right ear pain for the past 15 days. So on examination in OPD, what I saw was some granulation outside the extraumatic canal and wax inside the ear. So whenever there is granulation along with wax, it is mostly a case of keratosis obturans. But this case was different. I got a surprise at the end of the surgery. So since the child was very young, 10-year-old, and the pain was very excruciating, so I took the patient under general anesthesia and started removing the keratotic mass. So you can see some granulation outside, which was narrowing the external canal further, and some whitish flakes inside, which I'm trying to remove. These whitish flakes are basically the keratotic mass, which gets accumulated over time if the ear is not able to clean itself. So they are very stubborn to come out. So that's why I'm having great deal of difficulty in removing it. This is also because of the small space available. I am not able to negotiate the scope and the suction at the same time. You can see the suction is uh, mostly doing the job, and the scope is outside the stenotic canal, not even able to insert it. So this granulation is frequently being sucked inside the suction. The only fear remains that the granulation starts to bleed very easily. Once the bleeding starts, it becomes very difficult to visualize and negotiate the scope. You see, I have started to debulk the mass and how small the external canal has become because of this granulation outside it. The utmost care has been taken not to damage the granulation, because these are basically the proliferation of blood vessels. So they are ready to bleed. So these are the flakes, and I could get some view from the inside. There's still a lot of wax, and you can see the skin-like material inside the external canal. This is the main keratotic mass. Keratosis is nothing but the shed skin over time, which gets accumulated and they form layer by layer, and they put pressure over the external canal, causing pain. You see this skin-like structure inside. This is the main keratotic mass. In the lap of the keratosis, there is always some wax. You can also see whenever the suction is going inside, the whole ear canal is collapsing. So this is because the child is very young. He is just a 10-year-old kid with very soft cartilage, which because of the negative pressure in the suction, it gets collapsed, which also poses a difficulty in such kind of scenario where the canal is already compromised with the granulation. So you can see there is a lot of mass yet to be removed. But the surprise to me was at the end of the surgery, which I will tell you later. See, these whitish flakes are still coming out. At this time, I could see some pus and fluid, which was a bit surprising when I started to suspect that there might be something else, because pus and fluid are not a feature of keratosis obturans at all. So what I did was to go inside, I took a epinephrine soaked cotton ball and put it over the granulation so that my endoscope can rest over it. Then I could go inside to create some space and started to remove the remaining flakes. I wanted to see the status of the tympanic membrane, and you can still see there is a lot of fluid which is causing the bad quality of the camera. It is soiling the camera. Now, at this point, the surprise was very much clear to me. You can see some pulsation in the tympanic membrane. This pulsation is a rupture of the tympanic membrane because of otitis media. It is called acute suppurative otitis media. So basically what has happened was the patient had a long-standing keratosis obturans. Patient had upper respiratory tract infection recently, which got traveled to the middle ear, and middle ear got inflamed, filled with fluid and pus. It caused rupture of the tympanic membrane, and this pulsating mass, this pulsating discharge is a unique feature of ASOM, acute suppurative otitis media. You can see a lot of fluid whenever I am doing the suction, a lot of fluid coming out of it. You see, this fluid is soiling my endoscope. This is the last bit of keratotic mass, keratosis, which is lining the external canal, and see how inflamed the external canal has become. But the real surprise was this the rupture, because this is one of the few cases, rare cases where the disease is in the external canal along with middle ear. Both diseases are different. This middle ear infection is being treated by solely by the antibiotics, and the external canal, the treatment is removal of the mass and topical antibiotics. You see, this is the inflamed tympanic membrane. Some part of the keratosis is still left over the tympanic membrane, which I'm trying to remove. So remember, do not fiddle or try to remove each and every bit of the skin from the external canal, because these canals are often inflamed, and the more you try to fiddle with it, it can cause trauma to the external canal very easily and form further granulation. Remember, these canals, when the offending agents are removed, they heal very well, and they get well in like 2 to 3 weeks. So you can see easily that the central part of the tympanic membrane is still pulsating and there is some fluid coming out of it. This is also called a lighthouse sound sign. See the fluid coming out of the very small rupture. So with the course of 7 to 10 days of antibiotics, this patient became absolutely fine, and this small pinpoint perforation heals very well. The granulation outside the external canal is because of the pressure exerted by this keratosis. Once this pressure is gone, the granulation heals almost completely in 2 to 3 weeks. So this is the complete job done. Patient was discharged on the same day with oral antibiotics. So we followed the patient for 2 to 3 months. There was no further keratotic deposits, and the whole canal became healed. The patient was able to hear normally immediately, almost immediately after post-op, and the hearing improved within a span of a week. So this is the complete picture. Thank you so much for watching.